Hi, my name is Haley and I'm going to be demonstrating how to take a resident's manual blood pressure. Going to make sure that the bed brakes are locked. Hello, my name is Haley. I'm going to be your CNA for the day. How may I address you?
Sophia.
Hi, Miss Sophia. I'm cleaning my hands with friction until dry. I'm going to be closing your privacy curtain. Today I'm going to be taking your blood pressure. Is that okay? I'll be right back with my supplies. The supplies you will need for this skill are a pillow, a blood pressure cuff, your candidate recording form, a dual stethoscope, and alcohol swabs. I'm going to go ahead and make sure that my name is signed and printed on my candidate recording form. Hi, Miss Sophia. I'm back with my supplies. I'm going to first start by raising the bed for proper body mechanics. And then I'm going to situate my resident into a comfortable sitting position. I'm then going to go ahead and put a pillow underneath her arm. I'm now going to roll her sleeve up 5 inches from her elbow. I'm going to face my resident's arm out. And I'm going to use the blood pressure guide on the artery to follow and align it with the pinky side of my resident. And I'm going to make sure that my blood pressure cuff is at least 2 inches away from the elbow as well. I'm now going to clean my stethoscope, and may I have an RN test observer, please?
Okay, massive pulse is 120.
120. So I'm going to inflate my blood pressure cuff 30 above 120, so I will be inflating it to 150. I'm also going to make sure that when I put my stethoscope in, the earbuds face outward, not inward. I've put my stethoscope in. I'm going to gently double check that I can hear. When placing the diaphragm down at the stethoscope, I'm placing it down with 2 fingers, making sure not to use my thumb since my thumb has a pulse. And I'm going to apply good pressure to where it is flat against the skin to avoid any artifact noise. And I also would like to make sure that my cuff has space between the stethoscope and the cuff to also avoid artifact as well. I'm going to make sure the dial is all the way to the side and that I can start inflating. And I'm going to inflate my cuff to 150. And I'm going to slowly release my dial. I'm also going to let the dial go all the way through. And then to release, you twist the dial all the way to the left. If you fail to pump it up or release the dial at a proper time or just didn't happen to hear the blood pressure very well, you can only do 1 blood pressure per arm. So if I did not hear this blood pressure very well, I would then need to take the blood pressure on this arm. And now I'm going to record her blood pressure. Okay, Miss Sophia, I'm going to remove your blood pressure cuff. Going to throw these supplies away. And I'll remove this pillow. And I'm going to roll my resident sleeve back down. Okay, Miss Sophia, I'm going to lower the head of your bed back down. And I'm going to lower you down. Going to clean my hands with friction until dry. I'm opening up my privacy curtain. Here's your water, Miss Sophia. And here's your call light. You look safe, comfortable, and in good body alignment. You have your call light. Please ring it if you need anything. Otherwise, I'll be back to check on you in a little while. Going to make sure that my bed is locked, and I'm going to return my supplies back to storage. Skill complete.